Thank you, Mr. President. I wanted to join my colleagues on the floor today to support legislation that would address the needs that we're hearing from state and local governments, and that would support bipartisan legislation to address this pandemic. That's what we've had to date, and there's no reason why we can't get there this time. As you will know so well, last week the United States crossed a devastating milestone. More than 150,000 Americans, including 417 Granite Staters, have died due to complications from COVID-19. And sadly, as we all know, those numbers keep increasing. The coronavirus pandemic has also wreaked havoc on our economy. The Commerce Department reported on Friday that our gross domestic product had shrunk to nearly 33%, the sharpest economic decline in modern American history. For months, my colleagues and I have been coming to the floor week after week, urging the majority to take up proposals that would provide critical changes to our healthcare system and comprehensive relief for our economy. But what we've gotten is a package of bills that fails to address many of the concerns that I've heard from Granite Staters. The bill that was presented to this Senate by the Republican majority doesn't provide dedicated funding to help nursing homes and long-term care facilities, which are the most vulnerable to COVID-19. In fact, in New Hampshire, 80% of our deaths from the coronavirus have been to people in long-term care facilities, the highest percentage in the country. This package doesn't include housing assistance and eviction protections. It inadequately funds testing, and it pressures schools to reopen in order to receive assistance. And important, the bill lacks any support for state and local governments that are struggling to maintain essential services while they're also on the front lines of battling this pandemic. Every day, mayors and community leaders tell me about what they're facing. The massive reduction in local tax revenue and increased costs due to COVID-19 response efforts. These challenges have left our state and municipal governments in dire straits. I'd like to read, Mr. President, an excerpt from a letter that I received from Mayor Joyce Craig, who is the mayor of Manchester, New Hampshire's largest city. She says, and I quote, "Prior to the COVID-19 pandemic, Manchester was thriving. Over the past 2 years, we saw over $250 million in new private investments in economic development. We expanded air service from the Manchester-Boston Regional Airport, and we were seeing a continual decrease in opioid overdoses. But due to the COVID-19 pandemic, our bright path forward has grown foggy, and I'm concerned about what lays ahead for my city." Mayor Craig goes on to say that since the pandemic began, Manchester's revenue is down by over $3.5 million, including a $1.6 million decrease in property taxes that are collected. In total, the state of New Hampshire expects to experience a budget shortfall of nearly $540 million. That's about a 20% drop in state revenues. Mr. President, I ask unanimous consent that the letter that I quoted from Mayor Craig of Manchester be entered into the record.
Without objection.
Thank you. Today, I also spoke to the mayor of Nashua, New Hampshire's second largest city. Jim Donchis, the mayor, told me that he expects to lose 10 to 20% of the revenue base in Manchester, or in Nashua. So that's $7 to $15 million. It means that services would be affected and workers would have to be laid off. In fact, as he told me, if he had to take all of the savings that he would need to achieve from the revenue losses from just one agency, it would result in laying off half of the entire police department in the city, or laying off 150 to 200 teachers. Obviously, that's not tenable. I also heard from the mayor of Berlin, Paul Grenier, the mayor of New Hampshire's northernmost city. He told me that because of the impacts of COVID, the state of New Hampshire is also facing revenue shortfalls. As I said, they're expecting about $540 million in revenue losses. And as he said, if the federal government doesn't provide some help to state and local communities, that his city of Berlin is expecting to lose not just any potential funding at the federal level, but state funds that it had budgeted for because it was anticipating that it would get state funding as it usually does. So losing help from Congress in any COVID-4 package would have a double impact on the city of Berlin and other cities and municipalities across New Hampshire. So I've heard from mayors, from town administrators, from local leaders, from our Republican governor, Chris Sununu. All of them are grappling with whether they'll be able to fund the services that they have committed to, whether they'll have to lay off first responders or firefighters, police and teachers if federal assistance doesn't arrive soon. And New Hampshire's not alone. We just heard Senator Schatz talking about the impact on Hawaii, and Senators Cortez Masto and Rosen talking about the impact on Nevada. Everyone who's been to the floor is talking about what will happen in their states if we don't do something to help. No state could have anticipated the economic fallout from this pandemic. That's why it is essential that Congress provide federal support to help state and local governments as they respond to this crisis. We've done that before in the Bipartisan CARES Act. New Hampshire was able to receive $1.25 billion to help reimburse the state for its COVID-19 response. These funds have been used in New Hampshire to create relief programs for county and municipal governments, for small businesses, for nonprofits of all sizes, for frontline workers, and for healthcare providers. But of course, as we know, that money is running out, and so more needs to be done. We need state and local funds to provide additional support for families who are experiencing housing insecurity or homelessness. Minority and women-owned small businesses and individuals in recovery are in need of mental health services. New Hampshire has been severely affected by the opioid epidemic, and people who have substance use disorders are feeling the impact of this coronavirus perhaps more than their neighbors and other people in our state. In addition to providing dedicated funding for state and local jurisdictions, the next relief package should remove bureaucratic restrictions preventing governments from using emergency relief funds as they see fit. And unlike the CARES Act, Congress should also provide dedicated funding for counties, for cities, for municipalities with fewer than 500,000 residents. They need access to this funding because they're just as much on the front lines, the rural communities that dot my state, as the biggest cities in this nation. Communities of all sizes are facing substantial losses in tax revenue due to COVID-19, and they need our help. Local leaders are calling out for help. We can't just sit idly by and let these governments go bankrupt, as the majority leader suggests. And this shouldn't be a partisan issue. We all have a common interest in preserving as much of our economy as possible so that we are positioned for a full and robust recovery once we get this coronavirus behind us. So I would hope that all of my colleagues in the Senate would recognize the urgency of the situation that we're in, that we will take up and pass legislation that will provide assistance to state and local governments and provide the relief that Americans are calling for. The House passed legislation more than 2 months ago. Too much time has been lost, and it is time for Congress to act now. Thank you, Mr. President. I yield the floor.